The nation's dwindling mental health resources are contributing significantly to increased wait times and longer emergency department stays for patients having psychiatric emergencies. 3/4 of emergency physicians responding to a poll report seeing patients at least once a shift who require hospitalization for psychiatric treatment.
The severe shortage of psychiatric beds in almost all hospitals and lack of intensive outpatient resources is leaving these patients stranded for hours and even days in our emergency departments.
The ACEP poll and the research were presented at the ACEP 16 Scientific Assembly by ACEP President Dr. Rebecca Parker and research experts Dr. Suzanne Lippert and Renee Shaw.
I think all of us as emergency physicians have had similar experiences where you're really trying to do the best for the patients that you are in charge of. And the psychiatric patients that were coming into our emergency department were staying for days.
More than half of emergency physicians say the mental health system in their communities has gotten worse in just the last year, and the consequences of that play out in our emergency departments. Psychiatric patients wait in the emergency department for hours and even days for a bed, which delays the care they so desperately need. The ACEP poll also showed that more than half of emergency physicians reported increased wait times and boarding for children with psychiatric illnesses.
One of the reasons why we don't have a lot of mental health care resources is because a lot of our patients are uninsured or are Medicaid insured, and so these payers like Medicaid tend to have a much lower reimbursement rate than privately insured payers. And we know from practice too, it's much easier to transfer a patient who has private insurance to a facility than it is a non-private insured patient, a Medicaid patient or uninsured patients, because facilities don't take those.
It also leads to delays in care and diminished resources for other emergency patients. In essence, emergency departments have become the dumping ground for these vulnerable patients who have been abandoned by every other part of the healthcare system.
If we have crowding from one subset of patients, that can affect every other patient in the ED. And so we know this from, we're just working in the ER, that if we've got physically all these patients who are in the ER waiting to be transferred to another facility, that we can't take on more patients because we just physically don't have room or people to care for them.
We need much more accessible resources because it's a drain on that individual patient, but also on the community within which they live, in their work environment, in their families. It just is really affecting all of us.
For more information on this, please visit our website at newsroom.acep.org.